Each year, there are more than 600,000 admissions to secure juvenile detention centers in the United States. 2/3 of those youth will find themselves in overcrowded facilities, places that can't provide the level of custody and care that the law and professional standards demand. 2/3 of the youth are youth of color, wildly disproportionate to their presence in the population in general. The majority of kids in detention on any given day are kids charged with property offenses and violations of the rules of probation. These are kids who have angered adults, not kids who adults are afraid of. It's also important to understand that kids who go through this system in this manner will have much worse life outcomes than kids who are not arrested, are not detained, are not separated from their families and their communities.
And as we are in the 21st century, the design flaws continue to reveal themselves. And the more crowded it is, the more difficult it is to manage kids there.
One of the most basic principles of child development is that drawing children into this system isn't good for them.
But we're starting to realize that that doesn't work. We have too many kids locked up. The taxpayers are paying a lot of money for that, and they're not safer.
Research conducted in the early 1990s indicated that the nation's juvenile detention systems were arbitrary, expensive, ineffective, and discriminatory. Based on these findings, the Annie E. Casey Foundation, the nation's largest foundation devoted exclusively to improving life chances for disadvantaged youth, developed the Juvenile Detention Alternatives Initiative. A series of sites served as the testing grounds for this comprehensive approach to system reform by implementing a variety of interconnected strategies intended to change policy, practice, and programming. JDAI sought to demonstrate that jurisdictions could reduce reliance on detention without sacrificing public safety.
We are as political as any city in the United States. We're a very large urban center with 6 million people. We're the largest single-site juvenile detention center in the United States.
Our detention center was built in '73, and we have a capacity of 498 children. And at the time it was built, our thought was we'll never fill it. Well, in February of '96, we had 840 children in custody.
At that time, the population was very heavily black, as it is today, and there were long stays that kids were spending in the detention center, and sometimes for things that we didn't think justified it.
Our office hours were such that we concluded business by 5 o'clock every day and didn't work evenings or weekends. And these were the times that the kids in the community needed guidance and supervision.
In Multnomah County, we had a system that had some strengths, but it was a very disorganized system. I think a lot of decisions were made based upon entrenched past practice that was unexamined.
We sued Multnomah County because the conditions in the detention facility were pretty deplorable. The kids were in rooms that had exposed water pipes that the youth often would break as defiance measures, so the rooms were often flooded. The youth didn't have access to bathrooms unless the staff let them out of rooms, so a lot of times the youth would just go to the bathroom in the rooms.
We decide who would be held in detention mainly on a gut level feeling and on experience, but lots of times we had no place to put them, even if we knew they should not be in the facility.
Well, in 1997, we found ourselves having experienced 5 years of overcrowding in our juvenile detention facility. Additionally, we had significant disproportionate minority confinement of Latino youth, and we had underutilization of our detention alternative program.
At the same time, there's a growing recognition that our juvenile halls are filled with kids with mental health issues, with special education needs, with substance abuse problems. There's a growing population of girls who come from the dependency system with abusive backgrounds. And this has been a problem that really has a national face to it because as I've gone around through Annie Casey to other jurisdictions, I understand that there's a lot of people struggling with those kids with special needs or those kids waiting to go to placement, sitting for long periods of time in juvenile halls just waiting to get treatment. That really is almost a crime of the system, not providing treatment when the judge has ordered it.
How did these sites go about building a smarter, fairer, more efficient, and more effective juvenile detention system? They began by bringing together all the key stakeholders and community partners to analyze the current problems and to develop solutions based upon objective, reliable data.
We've really become very committed to the idea of using data in everything that we do to examine problems, to look for solutions to problems, and then in the evaluation of whether the solutions that we've implemented are actually working.
Once sites had learned to rely on data for policy and program decisions and had gotten the various agencies to work together, they could start to focus on aspects of practice. And the first issue that they had to take on was how they decided who would or wouldn't be admitted to secure detention and who should or shouldn't be in non-secure alternatives.
The risk assessment instrument gives points to a young person when they are delivered to detention to determine whether that young person should stay in detention or should be released.
Juveniles are to be released unless there's a risk of failure to appear at subsequent judicial proceedings or that there is a high risk of reoffense. And so that's what the RACE seeks to measure, is those two phenomena.
One of the causes of unnecessary reliance on secure detention is the absence of effective community-based alternatives to detention that could moderate the risk that a kid poses of getting rearrested or not appearing in court. And in the JDAI sites, a continuum of program options was developed that typically included home detention, day or evening reporting centers, and some number of shelter beds for kids who didn't have a home to which they could return.
The WACA organization has been around since 1971, and we focus on being a positive alternative for youth being incarcerated.
We became partners with Ernie Jenkins, and his decision to supervise kids in the community by bringing them into his center every afternoon and having all of his workers engage the kids in discussions really was the genesis of our Evening Reporting Center program.
We're very fortunate in Santa Cruz County to have several extraordinary community partners. One of those partners is Barrios Unidos, a group of folks who work in our community, come up to our juvenile hall and provide a lot of culturally appropriate programming for the youth here.
The work that we do within Barrios Unidos is trying to bring some hope into these institutions by being able to be there, to talk, to listen, to bring some education. Those individuals, those are our relatives. Those are the people from our neighborhoods.
They have a school-based program. They work on youth development and economic opportunities for young people.
Risk assessment instruments are designed to eliminate inappropriate admissions to detention. To reduce lengths of stay in detention, JDAI sites implemented a series of case processing reforms that shorten the time it takes to make critical decisions or that alter the underlying administrative policies.
How our case processing has changed as a youth is brought in overnight. We have an 11:30 meeting where we actually discuss their cases. The people include the placement coordinator, the district attorney, Department of Human Services, the youth's attorney, and at that time we look at what the best options for the youth are. The only two things that we really look at to make sure the youth is held in custody is the risk to the community or if they will return for a court hearing. So hopefully they've spent less than 24 hours in our facility if they do not need to be held in custody.
Nationally, youth of color now make up more than 60% of the kids in secure detention. In order to reduce racial disparities in the use of secure confinement, JDAI sites made special efforts to ensure that all detention reduction strategies were at least race neutral and were responsive to the particular needs and circumstances of youth of color. Multnomah County in particular was able to demonstrate that it is possible to reduce racial disparities in the likelihood of detention through determined leadership that eliminated bias and ensured that a level playing field was created.
In some ways, it's embarrassing to me that the small efforts that we have made here in Multnomah County are considered a national model. What we have done here is brought together a group of policymakers here in this community who care about this issue because they are personally committed to equal justice.
In all three of these sites, detention populations were dramatically reduced while juvenile crime also went down. In all of these sites, admissions are down, case processing times have been reduced, there has been increased use of community-based alternatives, conditions of confinement have improved, and for the first time, we have places that have made measurable progress in reducing racial disparities. In addition, these sites save millions of dollars by avoiding new detention construction or by shutting down unused units.
Annie Casey's detention reform initiative has been very helpful for us in giving us the tool bag to really tear our system apart and look at it.
The daily detention population in our facility has been greatly reduced, but without a resultant compromise of community safety. In fact, just the opposite. We have the lowest rates of reoffense that we've ever had.
It takes a while. It takes a while to learn, but once you see these other options, you'll never go back. It just doesn't work. We have an obligation, we have a moral duty. These are kids, and what we do has a huge impact on the rest of their lives, and we're responsible for what we do.